Ladies and gentlemen, good afternoon and nice to meet you again. So this afternoon I'm going to talk about the service delivery models for transgender people. And before I start my presentation, can I ask, have any one of you visited Tangerine clinic before, located at the Thai Red Cross? Raise your hand. It's kind of half and half. So after this symposium, maybe you may want to visit us at the Tangerine Community Health Center, and we can organize that accordingly. So why Tangerine? Why a transgender-led service approach in ending AIDS? Now, in Thailand, we have from the data from the Ministry of Public Health, we have the estimated number of transgender women population in Thailand. There's around 300,000 of transgender women in the country. But it is believed that they have more of transgender women population in the country. But at least we have we have the data to show that we exist in the country. And around 100 of transgender women, they're on active sex, and around almost 15,000 of transgender women, they are at high risk in the country. And the HIV prevalence is around almost 13%, with 2% of HIV incidents. And now, from the research study conducted between the Thai Transgender Alliance Foundation and the Transgender Europe Council, they found that 40%, more than 50% of the transgender responding to the questionnaire, they said they never receive advice and counseling from healthcare providers on gender-affirming care and hormone use. And almost 50% reported that they had negative experience from healthcare providers. And from another research study conducted by RTI, it's showing that they surveyed the attitudes among healthcare providers, and they found that 50% of healthcare providers who thought that HIV-positive transgender women should be ashamed and should be blamed due to their HIV status. And that's come to the conclusion that we may need to do something to establish a transgender service delivery model. And through Professor Prapan's leadership and Dr. Nitya's tremendous support, we organized the first community consultation in 2015, and we invited all the transgender communities representing diverse backgrounds to come and to learn from them what they really wanted and what kind of services they would like to see at a clinic. And we started by adapting and operationalizing global and regional guidelines and protocol to fit with the Thai context. So we review and adapted many guidelines, and this has been developed firstly by Dr. Fritz van Grinsven, which I met him this morning. He was one of the initiators to establish a transgender clinic at the Thai Red Cross AIDS Research Center, and I would like to acknowledge his tremendous support on this. He's not here in this room, I think. Yeah, so we learned from international experiences. We adapted the guideline from World Professional Association for Transgender Health and also the experiences from Europe countries. And here's we adapted the guidelines for the hormone treatment for gender transition. And we try to see what's the kind of hormones available in Thailand. We found that the challenges is those were recommended in the guideline, they are not available in Thailand. So we have to find the ways that how to procure those recommended and to be correctly used by the transgender communities in the countries. And how the Tangerine started up, as I told you, a way to promote meaningful participation among the key population is to ask them what they really wanted. And we organized the first transgender community consultation in 2015. Here, you can see that it was organized in September 2015. And 1 month later, we were able to establish or to open officially the Tangerine clinic at the Thai Red Cross AIDS Research Center. And every year we organize community consultation among the transgender community, but this is the second year in the picture we organize, and now we invited healthcare provider as well to come and to exchange the experiences and best practices, what works, what doesn't work among the transgender communities, and we come up with the solution and for our further development. And last year, we organized the third Thailand consultation on HIV and related health services for transgender women. Last year, we came up with the suggestion that the service delivery for transgender people need to be replicated. The model needs to be expanded to other provinces. We started by providing the technical assistance to our partner organization. They are community-based organization based in Pattaya called Sisters Foundation. They work with transgender, mainly they are sex workers. And also we're working with M+ and QSNCC. It's a community-based organization based in Chiang Mai. And we also work with Rainbow Sky Association in Thailand, in Bangkok, and in the south of Thailand called Songkhla province to provide or introduce the transgender health-related service. For example, this hormone level monitoring. And this year, we are ready to expand our technical assistance to service worker in group foundation or called Swing. And Kun Sarang is here. And we hope that we can engage transgender sex workers in Bangkok to come to use the services at Swing in the future. And in September last year, we partnered with the Asia Pacific Transgender Network to organize the Asia Regional Conference called From Barriers to Bridges. And we having a representative from more than 25 countries in the region and in other countries out of the region as well to come and to talk about what are needed and what are the appropriate service delivery models for transgender population in their own countries. And we were very honored to have Minister of Public Health of Thailand and the US Ambassador to Thailand coming. And this conference was supported under the USAID PEPFAR linkages project. And now, at the first year, I like to tell you it was not easy to come up with the perfect thing. So we actually, initially we had only a few staff started. We have one physician, who's Dr. Nipat. He's very supportive to our project as well, and our nurse and one counselor at that time. But after 1 year implementation, we're expanding our program team or our clinic team, and right now we have almost 2 physicians, 1.5 actually, and 2 nurses, and we have 1 clinic supervisor and 3 counselors, and also we have receptionists or navigator to help the client to facilitate their service provision at the Thai Red Cross AIDS Research Center. And right now, I think the similar lesson learned that we found is quite similar to the Vietnamese lesson, because we found that using social media and celebrity or the social influencer to promote and engage them in the HIV programming is very helpful for us. So we received the support from the Miss International Queen, and she's the Miss Tiffany Universe, which is the most beautiful transgender pageant in the world, I can say. I was not qualified actually. Yeah, and she's her name is Kun Mo. She's helped us a lot. Even she organized a small Facebook live session for 30 minutes. But a week after, there was a crowded transgender client coming to get the HIV services at Tangerine. But I can say that at the first time, they didn't want to come for HIV testing. They just wanted to come for hormone level monitoring and other health-related services. But by using hormone-related services can draw transgender people to have HIV testing, syphilis testing, and increase PrEP service uptake among the transgender women in Thailand. I will show you the number later. So now it's come to the defining a comprehensive service package for transgender people. So on the left-hand side, we come up with the full package of comprehensive service for transgender people. You can see that we have counseling testing, syphilis testing, hormone and hormone level monitoring, condoms and lubricant that we talked already in the morning, cervical, anal, and neovaginal pap smear. And we also have the high-resolution colposcopy, anoscopy, and for neovaginoscopy as well, which many of you might not know. Because when I first joined Tangerine, I didn't even know what the HRA for neovaginoscopy about, so I have to learn a lot from Dr. Nipat. And also we have Botox and skincare. It's kind of, because we found that from the guideline of the UNAIDS and the WHO, they found out that transgender population, they always sharing syringe and needles, especially for silicone injection, but to creating an entry point for the transgender to come to use the services, Botox has been introduced. But we learned that it doesn't work because it's very expensive. So this year, actually, we're trying to reduce the price, and by using the Korean produced Botox, because before we used the American produced, so it's very expensive. But they have the same quality from my experience. Yes. And now, it might be too ambitious in your context, but on the right-hand side here, you can see that we don't need to have full package of the service at the first time when we opened it. We can have a minimum service package for transgender people. For example, hormone level monitoring. This is something that is very easy, and it can be done right after we know that what needs to be analyzed in terms of hormone level monitoring among the transgender men and transgender women. And then we can integrate other HIV-related health service in one time as a one-stop shop when they come to use the service. But the lesson learned that we need to have more is about the mental health support. This is the new area for the Tangerine that we need to explore further. We found that anxiety, depression, or post-traumatic stress disorder is the important aspect as well that we have to address, because now we don't have any expertise, but this year we're trying to increase our expertise on this. And I think in the long run, we can provide like fully comprehensive support for transgender people. And before we start providing the services, of course, we provide the gender sensitization for frontline and healthcare staff. I remember on that day, Professor Prapan launched the mandatory policy for frontline and healthcare staff that everyone who have direct contact with transgender client has to attend or has to pass the gender sensitization before we open the Tangerine Community Health Center. So leadership in the organization is very important to push this forward. And now we also develop the forms that responding to their gender identity. We don't limit their sex only male and females. We have other boxes for them to go for whatever they want to be. But we have the option for sex assigned at birth and what the gender identity that they are. So we're not driving them away because of the only registration form. So our form is the first impression that to help the transgender person feel very impressed and welcome. And also we, right now at the Tangerine, we are conducting a research study which is led by these two impressive doctors here. Is about the interaction between gender affirmation hormone and antiretroviral drug. So the first group of the participants has been enrolled already last week. So we call this study named IFACT. So we study about the drug-to-drug interaction between the HIV-negative transgender women who are taking PrEP and hormone. And also another group, we study the transgender women who have HIV positive and taking ART and hormone in the same time. So this data from this study will be very fruitful and can be translated into HIV programming to inform the transgender client when they have any concern or question asked about drug-to-drug interaction. And now here's the flow. So maybe I will skip this because maybe you want to visit us one day. And now here is the current performance. Right now, we have 1,000 and 186 transgender people using the services is 2 years already. And of those, almost 1,000 people that are transgender women. And the HIV testing uptake is 91%. And of those, 20% of them are tested positive. And the initiation of the ART is 80%. And still, we are having the challenges on the increase the PrEP uptake because at the anonymous clinic, you have to pay for PrEP. So it's the fee-based services. But I mean, just 1 month ago, we started to launch the free PrEP service for transgender women, which is supported by the Princess Somsawari Fund. So we anticipate to see more transgender clients who are at substantial risk for HIV to get more PrEP this year. And the summary and the recommendations that I would like to share with you, that the first point is Thai transgender women have high prevalence and incidence of HIV and STIs. Transgender community-led health services which integrate hormone services into sexual health services are feasible and effective in increasing access to and retention in HIV testing and PrEP services. Health professionals in general still have limited understanding and clinical skills to provide services to trans people. Hormone and sexual health service package along with a clear and concise service provider training set are needed. Support to enhance knowledge exchange between trans communities and health professionals is necessary to increase access to and provision of transgender health service aiming at ending AIDS in Thailand and in the region. Lastly, data collection from transgender health service program is crucial for the development and refinement of health service package and health policy advocacy for transgender people in Thailand. And here are the different service model of trans that Thai Red Cross by Tangerine Community Health Center supporting the CBOs or community-based organization in expanding transgender-related health service. So we already work with Sister Foundation in Pattaya, as I told you, and we work as well with M+, who have different models working as a hybrid model with MSM and transgender women in Chiang Mai. So we, both of them, they have different characters and different scenarios in providing services to transgender women. And here I want to acknowledge again the great leadership of the Thai Red Cross AIDS Research Center, Professor Prapan, Dr. Nitya, Dr. Fritz, and also the Tangerine Community Health Center staff, prevention staff, and the USAID, Linkages Thailand. And most importantly, without the transgender community, we wouldn't have been successful like today. And before I finish, I would like to show you a few minutes of the introduction of the Tangerine Community Health Center in case you don't have time to visit us on Friday.
24 ชั่วโมงในวันหนึ่งมันแทบจะไม่พอสำหรับคนทำงานอย่างแจนค่ะเวลาที่คนข้ามเพศอย่างแจนอยากจะปรึกษาใครเรื่องสุขภาพแจนก็อยากจะไปรับบริการที่สะดวกรวดเร็วที่เดียวที่ให้บริการเบ็ดเสร็จเลยจะมีไหมนะ
คนข้ามเพศหลายๆคนต้องการการดูแลสุขภาพเฉพาะทางรวมถึงแพทย์ด้วยแต่จะมีคลินิกที่ไหนนะที่จะมีการให้บริการที่ตรงประเด็นมีเจ้าหน้าที่ที่เป็นทางเรา เราได้รับบริการที่เป็นมิตรจากพี่ๆที่เข้าใจเรามันทำให้เรารู้สึกเป็นตัวของตัวเองสบายใจไม่ต้องเจอสายตาที่ดูถูกหรือการเลือกปฏิบัติ
มันให้ความรู้สึกเหมือนอยู่ที่บ้านอยู่กับครอบครัวที่เราสามารถพูดคุยได้ทุกเรื่องเลยค่ะ
ลินิกสุขภาพสำหรับคนข้ามเพศแห่งแรกในเมืองไทยที่เสนอชุดบริการสุขภาพแบบบูรณาการและตอบสนองความต้องการของน้องๆคนข้ามเพศอย่างแท้จริงค่ะบริการที่มอบให้เราก็จะมีในเรื่องของการตรวจระดับฮอร์โมนการให้คำปรึกษาในเรื่องของการข้ามเพศและในเรื่องของสุขภาวะทางเพศต่างๆค่ะจุดเด่นอีกอย่างของคลินิกเราคือการให้บริการคนข้ามเพศโดยพี่ๆที่เป็นชาวชุมชนคนข้ามเพศเหมือนกันซึ่งสามารถเข้าใจเรื่องละเอียดอ่อนต่างๆทางเพศสภาพของเรา
ที่คลินิก Tangerine นะคะ เราคำนึงถึงสุขภาพของคนข้ามเพศเป็นสิ่งที่สำคัญที่สุดเลยค่ะดังนั้นเนี่ยเราก็จะจัดชุดบริการนะคะที่ตอบโจทย์ผู้ใช้บริการอย่างแน่นอน แล้วก็เป็นบริการที่ราคาย่อมเยานะคะสามารถเข้าถึงได้แล้วก็มีทีมบุคลากรทางการแพทย์นะคะที่มีความเป็นมิตรแล้วก็เข้าใจวิถีชีวิตของคนข้ามเพศนะคะดังนั้นเราก็อยากจะเชิญชวนนะคะให้แวะเวียนมาใช้บริการที่คลินิก Tangerine ค่ะเพื่อสุขภาพที่ดีอย่างครบวงจรนะคะ
Thank you very much. Thank you.
Okay,